Hi, my name is Julian Ortiz. I'm a student of Deakin University, Poet. My student number is 219-467-219. This is an assignment number 3 for HNN120. In this presentation, I will discuss the concept of interdisciplinary teams in healthcare, with a focus on their importance in providing safe and quality, and the roles of the different healthcare professionals in the team. I will relate this discussion to Peter's case. Nancaro et al. In 2013 defined interdisciplinary teams as a complex and dynamic process that involves 2 or more healthcare professionals with complementary skills and backgrounds. The professionals must work collaboratively to achieve a common goal, which is to provide optimum patient care. For interdisciplinary teams to work effectively, there are various factors that must be implemented. They include teamwork, person-centered practice, effective communication, and positive leadership. Interdisciplinary teams play crucial roles in the provision of safe and quality healthcare. According to Hanawa et al. 2015, safe and quality healthcare is built in 6 pillars, which include safety, effectiveness, patient-centeredness, timeliness, efficiency, and equity. Interdisciplinary teams help healthcare professionals observe these pillars because it pulls together skills and competency of different people whose problem-solving ability is greater compared to that of a single person profession-specific knowledge base. Interdisciplinary teams are important in providing safe and quality care because they prevent the occurrence of adverse events in the clinical settings such as medical and medication errors. Examples of medication errors that occur in clinical settings include insufficient or excessive doses, administration of wrong medication, and missed medications. According to Manaya's 2018, these errors occur due to gaps in knowledge, providing inappropriate rules or managing medications and memory lapses. O'Leary et al. In 2012 argued that interdisciplinary teams prevent such medication errors because complementary skills and knowledge are utilized by the various healthcare professionals involved in providing care. Consequently, this promotes patient safety and enhances patient healthcare outcomes because the right medication is provided to the right patient and at the right time. Interdisciplinary teams also promote safe and quality care by facilitating a more comprehensive and holistic records of care. Because interdisciplinary teams approach healthcare service delivery as a joint assessment and discusses diagnosis in a single setting, it helps prevent duplication of assessments and provide timely care, which leads to provision of comprehensive holistic care. This improves patient outcomes, achieves patient satisfaction, and minimizes operational inefficiencies. Lastly, interdisciplinary teams are also important because they play a significant role in the reduction of the cost of care and the length of stay for patients. It promotes provision of inefficient and timely services to the patient, which promotes quick improvement of health, minimized operational inefficiencies, also reduces cost for the clinical setting and the patients. In Peter's post-operative care, the other 2 healthcare professionals that will be involved include social worker and the primary care physician. The social worker will be involved because Peter has depression and his family situation, including financial problems, and his wife's health is likely to affect his mental health. The role of social worker will be to provide counseling to Peter and to enable him deal with his current health status and being far from his spouse positively. Without help, Peter can sink more into his depression. During counseling session, the social worker can also evaluate Peter's mental health and determine if antidepressants he is taking are effective for him or a change is needed. Another role for social worker would be identifying supportive services and resources that will be needed by Peter and his wife after discharge. This can include relevant authorities to provide a higher disability support pension. A physician would also be important for Peter's post-operative care because of the patient's hyperlipidemia condition, and monitoring his progress post-operatively is important. They would provide medical care for Peter's hyperlipidemia and ensure his surgical wounds are healing as expected. Registered nurses or RNs have a crucial role in interdisciplinary team. First, they play a significant role in creating or forming an interdisciplinary team. Because they serve the front line of healthcare after the initial contact with the patient, RNs determine which healthcare provider to refer the patient to and organize the patient care with other relevant healthcare professionals. Karam et al. 2015 stated that RNs commence and inform referrals to the other healthcare professionals. They are therefore key to the formation and effective functioning and success of an interdisciplinary team. Ika et al. 2019 supported this argument by stating that RNs have a crucial role in managing interdisciplinary collaboration. The dual role of RNs in an interdisciplinary team is care coordination for the patient. The Agency for Healthcare Research and Quality 2018 defines care coordination as the deliberate organization of patient care activities and information sharing among all concerned or involved with patient care, including healthcare professionals and family members. This enables the achievement of safer and more effective care. According to Karam et al. 2015, RNs are involved in organizing the daily patient care activities and sharing this information with other interdisciplinary team members. This helps achieve more effective and safer care. In relation to Peter, RN has the role of organizing every post-operative care activity that must be completed daily and updating the relevant healthcare professional on Peter's progress. For instance, they can organize a meeting with a physician or a social worker. Thirdly, RN have the role of providing information regarding the patient to the patient and patient family. One key benefit of interdisciplinary teams is to provide patient and family-centered care, and the team is expected to recognize the patient and family as a crucial unit of care. One essential part of this care is information sharing on the patient's condition with the patient and family. This helps understand the patient and family's needs and preferences, making them feel that they are part of the care plan. According to Visser et al. 2014, an interdisciplinary team must designate a primary healthcare provider to communicate with the patient and family members daily. Because RNs are, in most cases, with the patients during ward rounds, and when administering medication, they are first to notice any changes in the patient's condition. This makes them the best healthcare provider for the role of communicating the patient and family. In Peter's case, the RN should update Peter and his family about Peter's recovery progress. The final role is to handle patient's discharge process. Hunty 2016 argued that, as RNs are in the front line of patient admission, they are also in the front line of patient discharge. They are coordinate and communicate with the patient, family members, and other healthcare professionals in the interdisciplinary team about the discharge process or plans. By relating this role to Peter's case, the RN must take charge of Peter's discharge process to the rehabilitation facility for ongoing care. Communication is the basis of healthcare. It enables meeting patient needs and provision of safe, high-quality, and patient-centered care, as well as managing healthcare delivery. In interdisciplinary team working approach, clear communication is a crucial requirement. Because of the complex nature and demands of the healthcare work environment, clear communication facilitates solving complex patient care problems and continuity of care. One importance of clear communication among members of the interdisciplinary team is that it facilitates proper team functioning, which aids inadequate organization of patient care delivery. Carroll et al. 2012 argued that clear communication among the members, inclusive of all interpersonal behaviors and transmission of information, creates productive relationships among the members. Merlino 2017 also argued that every patient handoff and interaction among interdisciplinary team members includes and involves an exchange of information. To be effective from interpersonal, administrative, and clinical perspective, the information exchange among the members must be accurate, clear, and thorough. It must be shared in an open, honest, and compassionate manner. This means that clear communication is a must for a properly functioning team, facilitating adequate care delivery organization. Secondly, clear communication eliminates or reduces adverse events such as medical and medication errors. According to Carroll et al. 2012, communication failure is the major cause of adverse events, such as medication error, and sentinel events such as death in clinical settings. Shahid et al. 2018 supported this argument by stating that communication failure in a clinical setting can lead to serious medication errors, and medical errors such as repetitive tests and delayed transfer patients to critical care. This means that clear communication is key to the provision of safe and quality patient care. It also means that for an interdisciplinary team to achieve safe and quality care, there must be implement strategies that will facilitate clear communication. For instance, in Peter's case, clear communication would ensure that all details of Peter's care are written in his medical report. This would include documenting details in relation to Peter's mobility aid being changed. Lastly, clear communication among Peter's member of interdisciplinary team promotes continuity of care, because it facilitates proper transitioning of patient care from the departing nurse to the receiving nurse or from one facility to another. For instance, in Peter's case, clear communication through the handoff report would help continue his care because of the ease of the transition. However, a lack of clear communication through the written report would have led to the delayed change in the patient's mobility aid if the receiving nurse failed to confirm the change from the patient's notes. Using the role of freshwater in Jasper 2001 reflection framework, I have reflected on teamwork and the role of RN in the interdisciplinary team. I have learned that teamwork is crucial in the provision of safe and high-quality healthcare. This is because members of a team have different skills and competencies, which boost their problem-solving ability when compared to the ability of a single professional individual. I have learned that open and clear communication is the key to the functioning and the success of teamwork. Providing healthcare service in an interdisciplinary means that the members must constantly share the information amongst themselves. A team that utilizes clear and open communication is able to achieve the team's goals, which in clinical context is providing quality care and patient satisfaction. I have learned that communication failure among the members can affect care provision or cause adverse events such as medication errors. Through the reflection, I have learned that apart from the normal roles of RN, they also have an essential role in an interdisciplinary team. First, they aid information of an interdisciplinary team as they determine the relevant healthcare professionals needed by the patient during the first contact or during admission. Secondly, I have learned that RNs have the role of information sharing and communicating with the team members and the patient and their family members. These insights have an impact in my nursing practice as a nursing student. They will help in focus on the practical side of my nursing practice as a student, instead of prioritizing the theoretical part only. The reflection has made me create an image of what would be required of me if I am in an interdisciplinary team. I have noted that if it happened now, I would fail as a member in some aspects. Due to this, I have realized that although the theoretical part is important to me as a nursing student, the practical part is also essential. This practical part can address by developing skills that are key in teamwork. The teamwork skills that I need to further develop include communication skills, active listening skills, and collaborative skills. To develop communication skills, I will train myself on report writing or writing every essential information on a patient during my clinical placement. I will also practice clear and constant communication with group assignment team members. I will also develop collaboration skills during my time as a nursing student, during group work or workshops, through collaborating with other students for any assigned task. I will also further develop collaboration skills by working together or closely with patients and other healthcare professionals in any role assigned during placements. Lastly, for the active listening skills, I will develop them by being attentive and listening without interrupting my lectures, supervisors, and colleagues during placements. In conclusion, interdisciplinary teams are a crucial part of healthcare, and in particular provision of quality and safe healthcare. By bringing their complementary skills and knowledge together, the members of the interdisciplinary team are able to work together to provide high-quality care, which improves patients' outcomes. For interdisciplinary teams to function well and offer benefits associated with quality care, patient care, each member must attend their role in the team, which align with their responsibilities as a healthcare professional. For instance, a registered nurse must understand their roles as nurses, which are different from that of a physician. Apart from understanding the roles, clear communication among the team members is also vital in providing safe and quality care.